the fertility of a woman does start to decline after 30-35 years. So when we're trying to get pregnant later, the need for IVF is increasing because of late marriage and late childbearing. They are trying for a pregnancy. If this is a married couple or a partner together, trying for a pregnancy, the first thing we also do is we do a semen test. We take the eggs, we take the sperms, we inject the sperms into the egg, see how the embryo is growing. The embryo is formed. For 5 days it grows in the lab. So basically you can call it like a baby. We do not take the eggs out. We just monitor your egg growth. We may give some medication to improve the egg quality or form the egg. Single egg that is formed, we monitor it. And at the time when you would ideally have a natural intercourse, at that time we just take the partner's sperm, we clean it, we remove the dead sperms, we take a concentrate and we just put it inside. If you are going to plan a pregnancy after 35, it's better that you freeze your eggs earlier because there is no harm in freezing.
Hi, this is Deepika from Rednool. Today we have with us Dr. Erika Patel. I really wanted to ask you various questions on IVF because not everybody's got the awareness on IVF, and IVF has become very normal these days.
Yeah.
To kickstart with, I really wanted to ask because India was being very populated country, and as days went by, people have gone for this fertility centers and IVF. What went wrong, I'm not sure, but this IVF treatment is quite common now. But I really wanted to ask you what is the basic procedure in this, and to kickstart.
So coming back to why India being populated and IVF is on the rise right now, two main reasons. One of the first reason is women are tending to marry a little later now. Mm-hmm. Earlier, there used to be childbearing happening at 25 years, yes. 30 years. Now, we are career-oriented or any other reason, we don't have a partner. Mm-hmm. We want to delay our marriage and delay childbearing even more. So, however advanced the medical field is, the fertility of a woman does start to decline after 30-35 years. Okay. So when we're trying to get pregnant later, the need for IVF is increasing because of late marriage and late childbearing. Okay. Secondly, a lot of environmental factors, habits, lifestyle, obesity, alcohol, smoking, recreational drugs. A lot of these other habits have become more rampant than what it was before. And environmental factors, like you must be reading everywhere about plastics and pesticides and things like that are also affecting. And we are seeing the decline in fertility happening even in women before 30 years of age as well.
Okay, is that fertility just affects just the women or even men?
No, it
also?
definitely affects the men. So when we see a patient, I always see a patient as a couple. There is no male or female, it is always as a couple because if they are trying for a pregnancy, if this is a married couple or a partner together, they're trying for a pregnancy, the first thing we also do is we do a semen test. The first visit test, I would say, is a semen analysis for the sperms and a ultrasound for the eggs. Okay. Only then we proceed further because there's no point in just treating, because male infertility in fact is about 60%. If you see all the causes of infertility. So 60% of men we find abnormal semen analysis. So that's a very high number.
Okay. Yeah. And one such thing is that as a commoner like me, IVF is very painful. That is the only thing I know about that.
So probably that is one of the biggest myths because yes, in IVF we do take injections, but nowadays the injections are so nicer and advanced. It's like an insulin pen. Okay. Like all my patients take their injections on their home on their own. It's just the pen. Okay. It's the tiniest needle. If a lot of people know about diabetes and insulin, it is the most painless injections ever. And even the egg retrieval process is done under sedation. Okay. So to just quickly run you through your first question, what is IVF? IVF basically we give 10 days of injections. Which are these pen type of injections. We monitor the growth of the eggs. We take out all the eggs that we can. It's just one 15-minute procedure done under sedation, where we take out the eggs, and after that everything happens on our side. We take the eggs, we take the sperms, we inject the sperms into the egg, and then we see how the embryo is growing. The embryo is formed. For 5 days, it grows in the lab. So basically, you can call it like a baby of 5 day. So it's an embryo at day 5. We then freeze it. We prepare the woman's uterus and the endometrium, and then we put it inside. From then, the pregnancy is as natural as a natural pregnancy would be from this point forward. As if you would get natural, the entire pregnancy is, there's no high risk, there's no complications. It is as similar to a natural pregnancy from this point onwards.
One thing is that is it safe? Like, of course, it is a 5 day embryo, and also after that, it will be a natural process. But it will be like a lab grown embryo, and then it will be a natural process. No? So, how this is it safe? I mean, like.
So it is 100% safe because when we talk about lab grown, technically the eggs have come out from the woman, the sperm is the man's. And we have now highly advanced equipments in the lab. We have incubators which are at the exact temperature of the mother's womb. The embryos are put inside, the doors are not opened, there are continuous daily checks done for the temperature, for the pH, for everything. Basically, we have created an environment which is exactly similar to a mother's womb. So there is no difference between this and that. And then when we take it and put it inside, it is a 2-minute process. Even the temperature of the lab, the temperature of the OT, everything is very controlled, and everything is done in a very controlled environment to mimic a natural pregnancy. Yes.
One thing I have to know is that what is the difference between IVF and IUI?
Yes, so when we talk about these fertility treatments, we call them as ART, which is assisted reproductive techniques, where we are assisting the reproduction. So IUI is one of the very first steps that we do when a couple comes to us, young couple, no other factors. IUI is, we do not take the eggs out. We just monitor your egg growth. We may give some medication to improve the egg quality or form the egg. There's a single egg that is formed. We monitor it. And at the time when you would ideally have a natural intercourse, at that time we just take the partner's sperm. We clean it. We remove the dead sperms. We take a concentrate and we just put it inside. So it is just, we're just slightly assisting it in putting it a little bit more inside than what it would deposit in a natural intercourse, and then we just wait for the pregnancy test. So this is something that we do, but however, the pregnancy rates in IUI are not very high because we are not doing much. It's very, very similar to natural. So if they've not gotten pregnant in natural, in IUI also about 20 to 25%. So we give it a shot. We give it a shot for about 2 to 3 months. Beyond that, we recommend IVF because if you compare the IVF, pregnancy rates are about 75.
Oh, okay.
So, which is a big difference, but we do give it a try before we move on to IVF.
One such thing is that you initially said because women are more career oriented and they are delaying the marriage or giving birth to the child, probably they are extending it for quite a long time. But before this IVF, I mean, like this new thing for India, it is very new, freezing the eggs. So, is it healthy, or what is the procedure for freezing?
So I highly recommend, I highly recommend freezing your eggs because, like I said, no matter how advanced the technology is, the fertility of the woman declines. There is no drug that is there to stop that from happening or to reverse this. Has been made, and I don't think it can be made because women, unlike men, are born with a fixed number of eggs. Every menstrual cycle you lose about 10 to 15 eggs. So if you have 100,000 eggs at puberty, 40,000, these numbers, they keep on reducing. And after a point, after 35, that's when it becomes almost zero. That's when you hit menopause, right? So this is a very natural process. You cannot arrest it. You cannot reverse it. So if you are going to plan a pregnancy after 35, it's better that you freeze your eggs earlier because there is no harm in freezing.
Earlier means at what age?
Ideal would be less than 30. They are the most healthiest eggs you can see. Between 30 to 35 is also good. After 35 years of age, they have a little bit of genetic issues. So if you see when we used to talk about Down syndrome and things like that, the incidence increases after 35. However, I would still say at any point of time, if you have come and you are not planning a pregnancy, even say you're 38, but you're not planning a pregnancy at 40, still your 38-year egg would be better than your 40-year-old egg. So, younger the eggs, the better is the pregnancy, the lesser are the genetic implications in the baby as well.
So, freezing the eggs probably, I'm just giving an example for what if like we are freezing the eggs at the age of 28 and what if we want to give birth at the age of 35 or 36? Is it
Yes.
okay?
It's absolutely okay. So even in my patients who are frozen years ago, they first try naturally. This is only a backup. You don't have to use them. You try naturally. You do not get pregnant is when we take out the backup eggs, and then at that point of time we just same thing injected. We take it out. We inject it with the semen and we put it back inside. And the advancements in freezing, now we call it as vitrification, is so good that the eggs and the embryos that are frozen, when you take it out, they are exactly the same as how they were frozen. There's no damage, there's nothing that happens to them.
I asked about like what is the ideal time for freezing the eggs. I really wanted to know like what is the when they can start this IVF treatment. I mean, like of course they would have been trying. So
So, ideally, a couple should visit a fertility specialist after 1 year of unprotected intercourse. They should be having like no contraceptive used. Try for 1 year. This I'm talking if the patient is less than 35 years of age. If you are less than 35, try for 1 year. Not happening, visit a fertility doctor, get the tests done. Between 35 to 40, try for 6 months. Not happening, visit a doctor. Above 40, directly you should go to the doctor and get the tests done at least.
one such thing is that like recent times I could see like so much of fertility centers and of course the initial question was that but people are just worried like it is way too costly for middle class people to manage. So what can be done actually?
So the thing is, what we try to do is the entire costing of fertility, if you see, is most of it in the drugs. The fertility drugs are very expensive. So here again, I would say what happens is higher the age, say a 40-year-old with a very less number of eggs might require a higher dose of drugs. The earlier you go and visit a fertility specialist, it is better for you in terms of everything, the dosages, the success rate, equalizing to the amount that goes, because you try this immediately. Say 1 year you've tried, you're 28 years old, 29 you go, your chances of getting pregnant in the first shot are very very high, versus you wait till 35, 8, 10 years of marriage, then you go, then you might have to do repeated cycles, which will again increase the cost of it. So most of the cost is about the drugs and the lab equipments, because there's just too much material, media, things that are used in the lab, personnel, equipment, everything. So most of the costing is because of that. But I would still say that earlier you go, uh, it's easier to get pregnant in the first shot versus doing repeated treatments and paying again and again.
Okay. Another important thing is that women are not getting any awareness on this IVF or whatsoever because, like, there are many articles, there are many videos, but still people are not getting aware about how people should be cautious for freezing their eggs or just taking care of themselves. So, one such thing you have to share to the women is what it will be.
I would say that reach out to the fertility doctor. There is still in India a very big taboo to even walk into a fertility center. People don't want others to see, but I want them to know that there are in even in India, even in Chennai, all of these places, now it is a highly common practice. In fact, I would say that visiting a fertility doctor even before you get married, just to know what is your fertility potential, I think is one of the most intelligent things for a woman to do. Even for men, they should go and get their sperms tested. We call this as preconception or premarital counseling. I think it's very very empowering for women. to know their fertility potential, empowering for men to know their fertility potential before they even get into a relationship or a marriage or even planning a child.
Speaking of fertility potential, I really wanted to know, I mean, like this contraceptives. I mean, the recent times I've been hearing from people around me itself. They are taking their contraceptives. Even before the marriage, they'll have a relationship, and of course, they wanted to have a safe sex. But the thing is that contraceptives can sometimes be, I mean, be unhealthy.
No, so that is also another myth. Low dose oral contraceptive pills are extremely safe. They don't affect the fertility potential of the women. That being said, apart from that, we also don't recommend extremely long years and years of usage for its own side effects, not from the fertility point of view. So we always recommend taking a break after 6 months or 1 year for a couple of months and then restart it. But it does not affect the fertility potential of a woman. So I think contraceptives are safer versus getting an accidental pregnancy and having to do a medical termination, which really affects the lining of the uterus, the interior of the uterus. That is what will probably cause issues in getting pregnant in future versus the contraceptives.
Okay.
Yes.
Since we spoke so much awareness about the women being pregnant, of course, we really want to talk about the Penmai clinic, which is gonna launch. Yes. So it is like truly for only for the women. Or?
Only for the women,
Yes.
starting from birth to adolescent, to marriage, counseling, to infertility, to delivery, to menopause, to advanced gynecology, everything. We want to give a very holistic approach through this clinic.
So yeah, I'm sure I think like any doubts, women can just approach and I think they'll get their answers. And thank you so much, ma'am. I think IVF, I came to know like a broader spectrum. And thank you so much. Do you want to share something to the women?
No, I absolutely want to tell them that take your fertility in your own hand. It will only empower you. Save your eggs for the future. Do what you want. You don't have to be forced into marriage and childbirth just because you're getting older. There are many, many other things that you can do and many advances that you should actually read about and know about.
Yes. Thank you so much.
Thank you. Thank you.